This is Growth and Development of the Toddler, Part 2. So, make sure you've got appropriate toys for them. And when we have kids playing, realize this is not just something extra. This really is important. It's the major socializing medium for kids this age. The recommendation is 30 minutes of structured physical activity and 1 to 3 hours of unstructured physical activity every day. We really want parents to limit screen time. We're seeing lots of studies that show toddlers really don't need screen time. Encourage creative and physical play, so running, jumping, musical instruments, drawing, coloring, things that bring out creative. Toddlers typically do parallel play, so they want to play with other children, but they sit down next to them and do the same thing. It's not interactive, even though they enjoy being with other children. They are egocentric, right? They can't put themselves in somebody else's shoes. That makes it very difficult to share or not to grab other people's toys from them. They have a short attention span, so they're going to change toys and leave clutter behind them. They love toys that use all the senses. Things don't have to be expensive to be good toys. Just make sure they're safe. They are going to say no to lots of things, so parents shouldn't overreact to the no's. And in fact, if you can avoid giving yes/no questions, you're going to get less no's. And then reading. It's important to read to the children. So promoting safety at this age, they are increasingly mobile, which means you got to be more careful. Really got to childproof the environment. Car seats, this is our #1 mortality of kids once they're over a year, is motor vehicle crashes. So best thing is that car seat rear facing in the center back. And we do want to keep them rear facing until they reach the weight where the seat says you have to turn them around or they truly don't fit. In the home environment, avoiding tobacco exposure. We see lots of illnesses related to, or increased illnesses of kids who have had tobacco exposure. Prevent injury, things like water safety. Toddlers with that big head, if they lean over something and fall in, they can't necessarily get back out. So toilets, buckets, all of those things are dangers, not just bathtubs and swimming pools. And then preventing poisoning. Here's our rear-facing car seat. And here's how we prevent poisoning, right? Don't have the chemicals down low. Don't have a cupboard a child can get in, and keep them in the original containers. When they're in something that doesn't look bad, or especially if you put it into a cup or something that looks like something to drink, a kid will drink it. They're not going to drink it out of the gray bottle with the big, skull and crossbones on it. So keeping it in the original container is safer. And pools, have them fenced. So sleep for toddlers, 18 months old, they say 13.5 hours a day, 24 months down to 13, 3 years, 12 hours of sleep a day. They really do need a lot of sleep. Depending on their schedule, they may take one long nap or a short nap, but most of them sleep through the night and take a nap. Consistent bedtimes help, and especially having bedtime rituals. We do a bath and we read 2 stories, things like that, so that they can wind down and know what's coming. And then usually they say around 3 is when most kids will stop napping during the day. During mealtime, we want to make sure they're safe in the high chair and that their food is safe, right? They're starting to feed themselves, so things should be in small pieces that they can do themselves. We do want to make sure they get a good, nutritious diet. These toddlers, they start getting really picky, but we keep offering nutritious foods. And at this age, get the right size fork and spoon so that they can start feeding themselves, but not with really pointy tongs on that fork. Portion size should be fairly small. It's maybe a quarter of what an adult is. They say about a tablespoon per year. Increasing the textures in the food as the child gets older. Have the high chair to comfortable height so you can secure them in. Include the toddler and family meal times. When everybody sits down to eat, pull that high chair up. Praise them for trying to feed themselves, even if it's a little bit messy, but don't leave them unattended while they eat because they are at risk of aspiration. We want to make sure somebody's there. And then they're going to eat more if there's not a lot else going on. So a TV in the background is not going to help them eat. Common concerns. This is the age of toilet teaching, toilet training. It's also the age of negativism. They say no to everything. So eliminating those yes/no questions will help. Temper tantrums. Again, avoid things. Don't take them to the store during nap time. Thumb sucking and pacifiers. Not necessarily a terrible thing when they're small, but this is the age where we want to get them off of those things because it can change the developing teeth, their dentition. Sibling rivalry. Commonly, this is the age where they have a sibling. So you can see aggressive behavior starting to come out or regression to earlier stages, especially during a time of stress or change. And we do want to wean them to a cup. We want to get them off a bottle shortly after a year. Now, breastfeeding, in the U.S., the recommendation is we'd like to see babies breastfeed 2 a year and longer if it's mutually agreeable with mother and child. So how do you know if that child is ready for toilet teaching? Well, they have regular bowel movements. It's predictable. It's always in the morning, always in the evening, whatever. And that usually doesn't happen until they're about 2. They have the ability to tell you, to express that they need to go. Their diaper's not always wet, so they're able to hold things for a little while. They can and will follow some instructions. They have to have the manual dexterity to walk to their potty chair and pull their pants down. If they're following you or siblings, people into the bathroom and watching and are curious, that's a good sign. And if they climb onto their potty chair or the toilet and are kind of sitting there like they're trying to go, that's a good sign. Or playing and putting their teddy bear there. So discipline for the toddler, they do need limits. Negotiate a little bit, right? We're not going to let them run in the street, but we can let them have some things, right? They're trying to develop autonomy, so letting them pick their clothes, but they don't have a choice about going to the babysitter. Techniques to assist the toddler to learn problem solving means to give them those choices, but make sure they're real choices. When you're giving them instructions, keep that simple. We want to praise desirable behavior and then use extinction or time-out for negative behaviors. Extinction means ignore it. It probably will go away. They're trying out. If they heard somebody say a bad word, they're going to try it out. And if you don't react, they're going to stop. If you overreact to it, they're going to keep doing it. So extinction, ignore things that are ignorable. Time out if they need it, but the recommendation is 1 minute per year. And time out is kind of getting a bad rap these days, but it does work. But they need to sit somewhere and get themselves back in control. And during a tantrum, this is that extinction. Just as long as they're safe, you're going to ignore it. Parents really are the first teachers, so they need to model socially acceptable behaviors. If they see you being angry and yelling at people, that's what they're going to pick up and assume that it's fine. Parents also facilitate that language development, so they need to talk to their toddlers, and it's better to talk correctly. We really want to talk just a level above where the child is typically. Read. Even before the child can talk well, they can enjoy reading. Convey the family traditions, the spiritual values. That's how we learn our cultures, through our parents. But kids need a lot of emotional nurturing and psychological security. So make sure they're getting that.